Human Rights Watch is the largest international human rights monitoring organization that's based in the United States. We are based in New York, and we have, I think, researchers in 70 to 80 countries looking at all sorts of human rights issues, monitoring them, and reporting on them, and then advocating for change. And I work in the Health and Human Rights Division, and within that, I'm the only researcher that focuses on the United States. I research access to health care. I research healthcare and human rights violations for vulnerable populations. I have focused a lot of my work on HIV and the populations that are most vulnerable to HIV. The poor, African Americans and other minorities, sex workers, people who use drugs, transgender women, and prisoners. I've focused a lot of my work on HIV in the southern states because the South has emerged as the epicenter of the epidemic in the United States. The South has the highest number of people living with HIV live in the South. It has the highest rates of new infections are coming out of the South. It has the highest death rates from AIDS. So it really is ground zero right now for the AIDS epidemic in the U.S. My framework to look at this issue is to approach it as an environment of risk where there are many factors contributing to these high rates of HIV, and many of them are simply flawed policies that could be changed. So I spend a lot of my time advocating to change these policies. For example, there's a really strong objection to syringe exchange for people who use drugs, even though we know it's a proven HIV prevention tool. There's still a lot of abstinence-based sex education in the schools, so the kids aren't really getting the information that they need about HIV, especially LGBT youth. The South has some of the highest incarceration rates in the U.S., and we know that incarceration is a process that disrupts HIV medications. It increases your risk for becoming HIV positive, even if you've had just a very brief incarceration, because it drives up poverty and homelessness, which are two of the primary factors for HIV. So there's just a multitude of factors in the South that are creating a perfect storm of bad policy for HIV. For example, in a city like New York, they've reduced the transmission rate of HIV from injection drug use to almost zero because they have really flooded the zone with syringe exchange programs. So yes, I think in many ways there is a contrast between what other cities are doing in other regions and what the cities and towns of the South are doing. We approach everything at Human Rights Watch from an international human rights law perspective. So in all of my work, I also bring an analysis of why the federal, state, and local governments are actually obligated under human rights law to be protecting health and providing accurate health information, to be taking steps to implement the right to health. The role of the criminal justice system in driving the HIV epidemic in the U.S., and this is true not only in the South but throughout the country. So that's something that I've been working on, and I would like to see the movement for criminal justice reform really take on some public health arguments, because I think they're very strong public health arguments to keep people out of jail and prison. For example, when you have HIV and you go into jail, you face a lack of access to treatment, a lack of reentry connection back to your healthcare provider. It's extremely disruptive, and I think that's really true for a lot of chronic diseases. So we would advocate that, say, in every courtroom there be a health liaison that could divert people to treatment, whether their issue is drug dependence or diabetes or HIV, because it's not going to help them to go into the jail system. Same for mental health. I think that jails have become essentially mental health institutions, and they're ill-equipped to do that. So I think that whole system needs to be changed. So there are a lot of health arguments for criminal justice reform. I think, 5 or 10 years. I think there definitely is traction and recognition that that the jails are not the place to be trying to provide intensive mental health or even intensive regular health care. And I think that because it costs so much money to provide that, I think there's a recognition from all sides of the issue that treatment is better provided in the community. I've seen this particular meeting become more inclusive and more diverse. I think it's very good that this year they have a sex work track, they have a transgender track. They are really looking at, I think, more and more some of the hard and controversial issues that are really keeping HIV from being managed as it should. I think a lot of marginalized populations are becoming less marginalized at this conference. This is not a medical conference. There are other conferences for that, for HIV, scientific developments. This is a social and grassroots organization conference for HIV.